Hi, everybody, and welcome once again to Your City, Your County. Today, we're very pleased to have a very special guest with us. It's Cindy Kinnard, who is the Kewaunee County Health Officer. Cindy, welcome to the show.
Thank you for having me.
Thank you. Let me first ask you a few questions about your background, how long you've been here, and I suppose you need some kind of education to take on a position like that.
Absolutely. So I have been with the county for 23 years, but I have been the health officer for 6. And prior to my 23 years with Kewaunee County, I did 5 years at St. Vincent Hospital, and I'm a graduate of the University of Wisconsin.
Okay. What did you major in down there?
Nursing.
Okay, so you are an official nurse.
I am an official nurse, yes.
Okay, you don't look old enough to have been here 23 years. Good heavens, I look like I've been here 100, but anyway. Anyway, we welcome you to the show today, and we really appreciate you coming here. Kewaunee County has, like all of the United States, and I guess pretty much around the world, experienced problems with COVID-19. And that, of course, will be our major topic that we'll be discussing today and how it involves Kewaunee County. Can you give us a few statistics on how things have been going and how they look right now? And this show is being done, incidentally, on December 9th, 2020. So we can't guarantee that everything, that you'd be watching this in a few weeks, that it'll still be accurate. But as of December 9th,
Sure.
How are things going?
As of December 9th, we have had 1,831 positive cases. We recently have seen a slight dip in the number of cases that we're dealing with actively each day. Right now we're at about 94 to 95 active cases daily. We average about 15 to 20 new cases that come into our office each day that we follow. For comparison, back in September, we were looking at maybe 150 to 160 active cases on our caseload. So it's coming down a little bit. It's been slow, but I think we're seeing a little bit of an improvement right now.
Okay. What do you I guess base that on? I mean, I know the facts, but
Yeah.
but why do you think that's happening? Why do you think we're coming down a little bit?
Well, I think that we were hit quite hard in September. Following Labor Day, some of our highest case numbers came through. And so I do think that Kewaunee County may have hit a peak at that point, and now we're starting to see that decline a little bit. Statewide, Wisconsin was one of the hot spots, and we are off of that list currently right now. So we're not one of the states that is increasing at this moment. So, we're seeing a little bit of improvement.
Mm-hmm. Well, that's great. I'm glad to see that. And Wisconsin, are they doing a little bit better? Obviously, if they're falling off the top tier,
Yeah.
that's a good thing.
Yeah, I think it's starting. It's slow, and it'll be a pressing few weeks with the holidays here to see how things go. Will that stay on that even keel, or are we going to see another spike again due to the holidays? That's
Mm-hmm.
the question.
Yeah, I know a lot of people have talked about Thanksgiving, and obviously we've gone through that period, and we're going to be seeing maybe a spike coming after that. But yet, here we are on the 9th, and that was back on the 26th, I believe.
Correct.
So maybe we're not going to see that
Right.
spike.
Our 14-day mark would be tomorrow, and we
Mhm.
haven't seen that spike in cases from Thanksgiving. So, knock on wood, we're happy with that right now.
Yeah. Are people being pretty good about wearing masks and washing their hands?
I think that it's improving. I think that it was a little shaky at the start, and that we have had a little bit of kickback on wearing masks and things, but with the numbers that recently went up in the fall, I think people started to understand that it really was one way that they could protect themselves. I think single-handedly the best thing that you can do is stay home when you're sick. And if we can spread that message to everybody, that's going to be our biggest help in this matter. But other things that you can do are social distance out, wear that mask, and really be diligent on good hand hygiene.
I've driven around Kewaunee County as well as Door County quite a bit. I don't go much further than that.
Yeah.
And it seems as though there are places where people are being very good about wearing the masks, and there are other places where people just wandering around without any mask,
Yeah.
going into gas stations and
Right.
well, not grocery stores, but gas stations, it seems like a lot.
Right. If businesses are making it mandatory and posting the signage and really enforcing it, then people abide by it. But, you know, if there's a lack of maybe that enforcement when you're entering, then we see a little bit more lapse in people not wearing the mask as they
Yeah.
should.
I know there have been times, not recently too much, because I think I'm starting to get used to the mask, but there have been times when I've walked into a gas station and I thought, oh no, I forgot my mask, you know, and I felt really bad about that. But
Right.
that's a good thing. How many tests do you normally run during an average week, I guess?
I would say that we run for our county residents somewhere between 40 and 50 a day for Kewaunee County. We average about 25 negatives coming back each day, and like I said, we're about 15, maybe 20 positive cases a day that we're dealing with.
Okay, so you're catching quite a few of those.
Yeah, and you know, our testing sites have increased. We started a little bit slower than some of our neighboring counties simply because of our access to Brown County. People can go there quite easily to get the test, and there's multiple locations there. But now we're up to having 3 to 4 testing sites here in the county regular. So that's been a big help to our residents to get those tests that they need.
Good. Where do you test normally?
So the Prevea site in Kewaunee tests 5 days a week, and our Bellin Health sites in the county test both in Kewaunee and Algoma, and then we also have Door County Medical Center that tests here. So people are pretty able to call their medical providers, schedule that appointment, and get that test quite simply.
Okay. And if somebody wants to have a test done, they should call for an appointment?
Yes, they have to call for an appointment to get that test.
So at this point, there are no like drive-throughs as you see in maybe Green Bay or some of the larger cities?
Not in Kewaunee County. However, our residents are welcome to go to UWGB, and they have a rapid testing site there that anyone can go to. We are also welcome to go to the Brown County Fairgrounds that has a large testing site. And then in Oshkosh is the Sunny Expo Center there, and they also have a large testing site that's run by our Wisconsin National Guard.
Okay. And at those sites, do you have to, if you have a sniffles or if you have a sore throat or a cough, is that the only way you should go through those?
They do ask that you have either a symptom or you've been exposed to somebody positive to use those sites. Yes.
I know that it seems as though when we were early in the pandemic, it seemed as though we did more, at least the idea was to do more follow-up with people. Oh, gee, you've got, the coronavirus. Well, who have you been visiting lately?
Correct.
Do you still do that?
Kewaunee County does. We're one of the only counties in this area that is doing contact tracing as it was done when it started. So we will contact every positive case, and then we contact all of the close contacts of that positive case. Some of our neighboring counties, when cases surged and staff got overwhelmed with the number of cases coming in, continued to do the positive case follow-up, and then have gone to a method where they ask their positive case to notify all their close contacts.
Okay.
That is not what we do here. We still notify all of ours.
You do that. Okay, great. Do you, and I have heard in the past that people don't necessarily identify, oh, it's, Joe Smith that probably gave it to you.
Right.
Do you release the names of those people?
So what we do is we ask our positive case if we can share their name. If they allow us to share their name with the contacts that we're calling, then we will. Otherwise, it's simply you've been identified as a close contact, and therefore we need to issue you a quarantine period, and we
Okay.
go from there.
So if you find somebody through contact tracing that is, liable to have
Mhm.
the virus, then it's up to them, just more or less individually and voluntarily to go and sit in their house for 14 days?
Correct. It's basically on the honor system that you're trusting that they're going to do this. We've been fortunate that the Wisconsin CARES program through our Department of Labor has paid people during their quarantines. So they are reimbursed if they do miss work. But yeah, we do ask that they quarantine 14 days from their last contact with the positive case. We've had a little bit of a change recently where the CDC has offered some new guidance in the last few days.
Mhm.
So some of those quarantines can be shortened a bit if the people agree to do self-monitoring for the remainder of that 14-day period,
Mhm.
which means that they just record their temperature and their symptoms daily, put it into a state database system.
Okay, and that seems to be working.
Yes.
You don't have to go pounding quarantine signs on buildings, right?
No, we don't, thank
Okay,
goodness.
Yeah. I remember seeing the old movies, you'd see the vaccine,
Right.
you'd see the quarantine sign up there,
Right.
everything like that. Well, we're hoping, as is everyone, I'm sure, around the world, that we're going to be getting these vaccines pretty soon. I watched yesterday, and at that point, England, or
Mhm.
I guess Great Britain, they were giving out their first shots, and a grandmother who was 90 got the first one, and
Correct.
William Shakespeare,
Yeah.
strangely enough, got the second one. They said he wasn't related to the original one, but so anyway, how soon do you think we can expect to have that vaccine in Kewaunee County?
I think that we could possibly see it in the month of January. So right now, the government has until tomorrow to approve the Pfizer vaccine. If that one goes through, it will go through by tomorrow. And then each state, I think it's about a 2-week lapse for the states to get their vaccine allotment from the CDC. And then we'll see it trickle down from there. I'm not entirely sure how many doses will come specifically to Kewaunee County yet. They haven't given us that information. And it's primarily that first round going to go to hospital staff and then residents of nursing homes and staff of the nursing homes and things. So we'll see how that trickles down to us.
Mhm. Do you have any concerns about the safety of the vaccine?
You know what? Just like every other vaccine, it still has to go through all of the trials and all of the tests that a normal vaccine would, even though it's gone through a little bit quicker because of the state of emergency that we're in. So really, I think that once the FDA passes it, it'll be good to go.
Mm-hmm. Okay. Now, there are going to be, as I understand it, basically at this time, two different products that will be available, two vaccines, Pfizer and Moderna.
Mhm.
Pfizer requires temperatures real cold,
Correct.
way down on the Celsius scale, and Moderna not so much. Do you know which vaccines we'll be getting here in Kewaunee County?
We do not know. Pfizer's going to be the first one released. Like you said, that is a deep freeze vaccine. So it will have to be kept cold on dry ice for people who do not have the equipment capable of holding it at a steady temperature. And for most local health departments, and even probably some of our healthcare facilities, that will mean that it will have a shortened shelf life. So it'll have to be used fairly quickly once you receive it.
Okay.
For Moderna, that can be held in a normal freezer. So we'll have a little bit more leeway as far as once you receive that vaccine to getting it administered.
Mm-hmm. Okay. So like with Pfizer, does it have to come out of the freezer and they say, okay, we're going to give you the shot now?
Typically, you have about a 30-minute window. Once it's, you're going to have to reconstitute it because it'll probably be a powder. So you reconstitute that vaccine and then, and I'm not positive of that, but that's how most of our freezer-based ones are right now.
Mm-hmm.
And then we have 30 minutes to get it.
Oh, okay. All right. Does Kewaunee County have enough facilities to keep it cold? Are there enough places that have those?
It's going to be a
freezers?
matter of us getting dry ice to do so. So we're going to
Mhm.
have to look into that. And unfortunately, it's hard to do when you don't know that time frame yet as to when you're going
Sure.
to need that.
Yeah, yeah. I remember in high school taking a biology class, and we worked with liquid, I don't know, whatever it was. It was real cold, though.
Yeah.
I remember that, and we'd like freeze goldfish.
Yeah.
You know, I mean, we weren't trying to be funny, but we thought maybe we could freeze them and then bring them back,
Sure.
you know, to life. Unfortunately, a few got dropped and they shattered. But that's another story. But anyway, I know how cold that stuff, you know, really is, and you sure don't want to put your finger in there, or your
Correct.
finger will freeze and maybe even crack off. So we certainly hope that doesn't happen. Let's see. After we get the vaccine, and people start, you know, getting the shots and all of that, do you expect that we'll still be wearing these masks?
Once we reach a certain point of coverage, we should not have to. So that magic number is 70%. So once 70% of the state has received vaccine, then we should be able to count on herd immunity,
Mm-hmm.
basically, to help control the virus.
Yeah. When you speak of herd immunity, when you speak of
Herd immunity.
herd immunity. Thank you. With the virus, and at that time they erroneously called it the Spanish flu back in 1918. People got over that eventually.
Right.
Of course, they didn't have a vaccine for it. Was that done, this herd immunity way, do you think?
Probably, sure, because the more people that became exposed to the virus and had the virus built up immunity naturally. So it's that same concept. The vaccine just helps build immunity quicker.
Mm-hmm. Yeah, and we don't have nearly as many illnesses and deaths and that sort of thing once we get the vaccine going.
Right.
Okay. Let's see, I've got a few good questions
All
here
right.
for you. Let's see, what about the cost? Is there a cost for the patients who are going to be getting the vaccine?
I don't believe there will be. So for people who are on Medicare, Medicaid, Badger Care, those kind of insurances, that will be covered through those entities. And for people who have regular health insurance, out-of-pocket health insurance, there will be a stipulation put out by the federal government that it has to be covered.
Mm-hmm.
So it should not really cost anything to any person.
Mm-hmm. Now, if somebody doesn't have insurance, I guess then that's a kind of a question.
Yeah, and
but
I think that
hopefully-
would probably be covered similar to what our state vaccine programs do now, where if you have no health insurance at all, vaccinations are then just provided.
Mm-hmm. Good, that's a
Yeah.
good thing. So nobody really has to worry about, well, I can't afford it.
Correct.
You know, what am I gonna do? Do I get that or do I have a meal?
Right. No, the ultimate goal of the state is to make sure that there's full coverage for everybody, irregardless of what their financial state is.
Mhm.
Yeah.
Okay. Now, I understand with the vaccine that there is a waiting period, and you get one shot and then you get another one like 21 days later?
Correct. For Pfizer, I believe it is 21 days between the two doses. For Moderna, I believe it is 28 days between the two doses. So roughly about a month apart is what they're going to schedule those vaccines.
Mhm. Okay. And so if you get Moderna the first time, you better get Moderna the second.
Yes, that is one stipulation with the coronavirus vaccines, is that you have to stay with the same name brand.
Mm-hmm.
So how I understand what the state is doing is when they give that initial allotment of the vaccine out, that same number of doses will be held back and then reissued to the state for those exact same people so that they get both doses and are complete, if that makes sense.
Yeah.
Yeah.
So they better not be traveling to, say, Ethiopia or
In
or
between, correctly.
England or something like
Correct,
that.
yes.
You know, that they better stick around for their
Right.
second shot.
Right, and I'm
Okay.
sure that there will be some follow-up program put into place where we're doing some kind of callback or scheduling appointments at the time of the first dose so that they make sure that they get that second one.
Okay. In my case, I should probably write on my hand M or P. Is that correct?
Right.
That would be helpful. Okay. Who will be giving the shots?
A number of different entities will be giving shots. So the state has a contract out with both CVS Pharmacy and Walgreens to do the residents within our long-term care facilities. And then outside of that, a lot will fall onto the local health departments and or other healthcare providers. So any one entity who wanted to give the vaccine could fill out a contract with the state of Wisconsin to be a vaccine provider. So that included pharmacies and clinics, hospitals, local health departments. So even some of our larger nursing homes could choose to do their own if they wanted to. It requires you to have a medical director that covers and will sign standing orders and things like that.
Okay. We hear a lot about scams, and people, I've heard of this happening, that, oh, send us $50 and we'll send you the fluid. Doesn't work that way.
Doesn't work that way. So you will actually have to come to a vaccination clinic, probably a mass vaccination site, where either your healthcare provider or the health department are present, and they will be providing the shot as you go. So you may see, similar to what you're seeing with testing, drive-through sites, things like that going on.
Mm-hmm. Okay. So as of this date, which we expressed earlier as December 9th, 2020, we probably don't know exactly where we're going to get the shots and who we have to call and exactly how those logistics work.
I would recommend watching some of our local media outlets. So we will have it in the local papers. We will have it on our website at the county. We will also have it on our our Facebook pages, social media pages, letting you know where you can call and how you can schedule those appointments.
Mm-hmm. And I'm sure radio and TV will be covering
Absolutely.
that
Yes.
as well.
Yes.
So that should work. Let's see. Another question I have, getting away now a little bit from the COVID. What do you normally do?
Good question. So our health department has a number of different grants that we receive each year, and they entail WIC, which is our Women, Infants, and Children program, Fit Families, which is a program that is based through the maternal child health and SNAP Ed programs that focus on kids and keeping them physically fit and eating the right foods. We are doing our immunization programs. We're frequently in the schools offering health and vision, hearing screenings. We do vaccination programs in the schools. We have preparedness, which we help write a lot of the local emergency preparedness plans for the county. We do foot care clinics. We do all sorts of things that the health department has just been a little bit quieter right now on those programs, simply because COVID has been a little bit overwhelming to a lot of the local health departments here.
I would imagine.
Yeah.
Do you have people that work with you, or is it just pretty much you?
No, I do have a staff. So I have a staff of 5 that are regularly with me. We have a registered dietitian on staff. We have another nurse on staff. We have a nutritionist on staff, and then we have our administrative assistant. In addition, though, right now, we have hired 4 contracted contact tracers who help and assist with COVID, so that our regular staff can still offer the programming that we normally do.
Mm-hmm. Yeah. And that's another, I'm not saying that you're offering a scam, but sometimes I've heard of people calling up and saying, well, I'm the inspector, I'm the follow-up guy, I'm doing the contact tracing. So they have to be careful that, it's really your department that's
It really is a local health
them.
department that will call each person that tests positive.
Mm-hmm. Well, that's a good thing. That's a good
Right.
thing. Do you do a lot of traveling with your job around the county?
Typically, in a
Mhm.
normal year.
In a normal year?
Yes.
Uh-huh.
Right now, not so much.
Mm-hmm.
We've been far more based within our office. We're one of the few offices that didn't work much from home over the last year. We've been in the office every day simply because with the amount of faxes and calls and services that we're doing, it's easier to work as one group.
Mm-hmm. That's kind of I sell real estate, and that's kind of how our office has worked. That a lot of us, come in, but then again, a lot of people can work from home.
Right.
So that's a good thing. Even coming into the building here today, at the Algoma City Hall, I had to call and get
Yep.
let in the door.
Yep,
So
exactly.
that just is pretty much how it works. So that's very interesting. Do you, as we look ahead, do you foresee any problems with the virus that we haven't covered? Is there anything that I haven't mentioned that you think, well, that could be a problem? Maybe we should be looking out for that.
I think hopefully in the next couple of months we will see things settle down. We're going to get that vaccine. You're going to see those mass vaccination clinics take part in the community. Once we get our healthcare workers and our seniors in the facilities taken care of, we'll see some of that opening up to the general population in the schools, that kind of thing. So hopefully once that happens, we should see numbers improve dramatically.
Mm-hmm. Do you foresee that there will be a situation where there will be a number of people who will say, I'm not going to take the vaccine?
Yes.
Mm-hmm.
Absolutely. And we always experience that every time a new vaccine comes out. There's always people who fear, getting the vaccine. Can it be trusted? Is it safe? What the studies are showing right now is that it's an incredibly effective vaccine. Moderna's at 94%, Pfizer's at 90% effective. If you look at a normal flu vaccine, the efficacy is about 40%. So it's incredibly effective in regard to that virus. And, people worry about, am I going to get sick from it, things like that. Typically, a normal vaccine, you have a little bit of redness, maybe soreness at the site of injection. You might feel achy or down for about a day. That's normal. I was listening to a vaccination webinar yesterday, and the head of the immunization program said, that's just your body's immune system kicking in. We expect that. That means it's working. So I think going forward, that's an important thing for people to remember. It's okay if you feel a little achy or sore for a day or two, because that just means that hopefully it's taking effect and that it's doing what it's supposed to do.
At the same time as we're looking at the COVID-19, a lot of people are also looking at the flu.
Yes.
Is there any relationship between the vaccine that's going to be offered and the flu vaccine? Is that any reaction there you're expecting?
No, they won't interact or react together at all. We're heading into flu season. Typically, Wisconsin sees our peak sometime between late December and January with influenza. We've been very fortunate. The state's been quiet right now with influenza.
Yeah.
But, moving forward, I think it's important for people to remember that they still need to protect themselves from that, too. So flu vaccines are available at doctor's offices, at the health department. We certainly have it for all age groups. So it's really important moving forward to make sure that you're maintaining your immunity the best you can and getting that vaccine so that doesn't bring you down.
Yeah. I've, at my age, I know that I should be getting the influenza, shots. Never done it before, but this year, I think I'm convinced.
Yeah.
I really do. I think I'm going to get it, and I know that pharmacies offer them too, so that's likely where
Absolutely.
I will be.
And we
where
still
I'll
have
be getting
doses
it.
at the health department.
Okay.
Yeah.
Very good. Okay. And I always hate to get into items politically. It seems as though the vaccine and the masks and so on get a little political. Have you experienced any of that at all?
Yeah, definitely. We've experienced it. I think everyone across the state and the nation has, and hopefully moving forward some of that settles down too.
Okay. Well, hopefully as the virus comes under better control, that will settle down as
Agreed.
well. Like I say, I don't like to get into politics
Right.
too much, but it's worth mentioning. Okay. Well, that's really pretty much going to do it. This half hour has absolutely flown by. It's been one of the most fascinating shows that I think I've done, and I certainly want to thank you so much for being with us today, Cindy.
Thank you for having me. I appreciate it.
Thank you. We've been talking with Cindy Kinnard, who is the Kewaunee County Health Officer, and along with her assistants, we've been talking all about what's anybody else been talking about, the coronavirus, the COVID-19, and we hope for you that you stay healthy, wear the masks, wash your hands, be careful who you associate with, watch all of those things, remember social distancing, and that's all I remember. So we thank you very much, Cindy. And that's going to do it for our show today of Your City, Your County. We thank you so much for being with us. We hope that you have a great day, and we'll see you next time. So long, everybody.